for this year, we decided to try something a little bit new with kind of the format that we were doing last year. So we're still going to have our monthly presentations, but we'll focus 1 month on a little bit more of education about different types of cognitive processes. Last month was memory focused. And then the following month, we're going to do a little bit more of, actually, let me back up. So then after we do the kind of the education on the cognitive processes, we'll include some strategies, some tools, possibly even depending on the topic, some activities. And then the goal for the month in between meetings is to focus on using strategies and using tools so that when we come and we meet the next month, we can have a little bit more of a discussion. So the reason that we thought about changing this method was, it's very easy to get all of this information, but the important part is that we're taking what we learn and actually apply it. So we're going to try this method out for a little bit in this structure just to see how it works. But with that being said, this is not any formal diagnostic or treatment for what we're going to discuss today. If you do have any symptoms related to any of the content of this presentation or any other condition, please make sure you consult your medical professional who can then guide you along the way. So as I mentioned, this month, we're going to be focusing more so on the aspect of memory when it comes to cognition within the Cognitive Toolbox. So to kind of review briefly, last month, one of the main ideas that we talked about when it comes to cognitive strategies and tools, we use the term I travel, which is actually a strategy in itself. So each letter in the term I travel stands for a different strategy. So we're going to go over those briefly just to kind of aid in our discussion following our review. So the first strategy on here, I, stands for immediacy. Immediacy is exactly what it sounds like. If we do things as they come up, then we might not need to think about them as much later. It frees space in our mind, so to speak, to dedicate to other things that maybe we can't do right away. Ideally, we would be able to drop things and, if we're having this discussion and you think of something that you need to do, ideally, we would be able to just drop it, what we're doing, and go do something else, but that doesn't always happen. So a lot of times I encourage my own clients that if we can't do things right away, let's get in the habit of using our tools, writing things down right away, getting things out of our head and getting them somewhere else. Which leads us into a little bit of a review about tools. So T stands for tools. And like I said, that's anything that takes over your memory for you. It's getting it out of your head and getting it somewhere else. And this can be anything. And this is highly tailored. And this is what when actual cognitive therapy can be helpful, or maybe even getting ideas through these groups. And this can be planners, journals, dry erase boards, using any type of technology, setting alarms, reminders, and even family and friends can actually be a tool. I try to encourage people not to rely totally on family and friends, but there are certainly times when it's appropriate to ask when maybe our strategies aren't as effective. Hey, when is that appointment? Or when is so-and-so's birthday? So family and friends can be a reliable source. The next strategy on here, R, stands for routine. And routine basically means that we make things more automatic. And this can be something similar to always keeping things in the same spot when you're at home, or we're at work, or wherever. You know where to find it because this is where you always keep it. Ideally, that would work all the time, but sometimes when people move things in our environment, that might not be as effective. But kind of having some type of routine can be helpful. That can also go the same for having a routine throughout the day. A lot of times I'll ask my patients, kind of when we start therapy, how do we manage our medications? And they'll say, well, I don't use any strategies. I just take them at breakfast, lunch, and before bed. And I kind of try to goes to show that you have routine. So you eat breakfast, you take your pills. You eat lunch, you take your pills. You brush your teeth at night, you take your pills. So having some type of routine and structure to the day can be very helpful. A stands for association. And that basically just means that we pair or group things together to help ourselves remember. So this one I think is a little bit more difficult sometimes because it takes some active thinking and implementation. So, but I do tell people, I don't care how you remember things, as long as you can associate them in a way that makes sense to you, I'm totally fine with that. A lot of times I'm really bad with names. So I will associate something new. So a new person's name that I meet, maybe with somebody I already know with the same name. Or I'll try to find maybe something we have in common or that we don't have in common and associate that person with their name and their face to help with memory. So that, again, like a lot of these can be highly individualized, but it is a tool in your toolbox. V stands for visualization, which basically means that we're forming mental pictures of things to help ourselves remember. I don't know if anybody else has experienced this, but sometimes I know I walk into a room and I don't remember why. And sometimes it helps to kind of think to yourself, what was I doing? So closing your eyes, visualizing what you were doing, and seeing if that helps to trigger, any memory as to what you were doing that prompted needing to go do something, to go get an item, whatever you were doing. E stands for environmental rearrangement. And that basically means that we move things in our environment to remind ourselves to do something. So that can be something as simple as putting a sticky note on the refrigerator to remind yourself to pay a bill, or putting something on the by the doorway so that you see it on your way out and it reminds you to take it. Anytime that you're altering your environment in order to remember to do something is considered environmental rearrangement. Sometimes it gets a little confusing when it comes to that and routine, but routine is keeping things in the same spot all the time versus environmental rearrangement is intentionally moving something to trigger memory. And the last strategy on here, L, stands for listen and attend. So the basis of all of this is that we cannot remember things that we're not paying attention to. And so, it's really important to make sure that maybe we're limiting distractions that are around us, that we're actively engaging and actively focusing, because sometimes that's actually more of the issue than the memory itself. So just some additional strategies. Rehearsal and repetition are helpful. The more that we do something, the more easily we can remember it. And that can be actively doing an activity or even just talking our way through things or repeating something over and over again. One of the examples I use a lot of times is maybe remembering a passcode that you might need. If you have to remember that number or word, repeating it over and over again until you have to use it. Multisensory approaches are one of my favorite things to kind of reinforce with my own clients. The more senses that you have involved, this increases your retention and can increase your memory. So simply hearing something that somebody says might not be effective, but this is where writing and maybe using tools comes into play. When you just hear something, like I said, it might be hard to remember, but if you write it down, you have a tactile component. So you're holding that pen or pencil to write it, or typing on your phone, but then you also are seeing it. So you're involving 3 different senses at one time, which increases your memory. And you can say it out loud too, which adds another piece to that. Chunking information is another strategy. So I always think of this more so like a phone number. It's a lot easier to remember a series of 3, and then 4 numbers versus one large 10-digit number. So sometimes you can break information down into smaller parts, and that can be helpful. Acronyms, Roy G. Biv is a big one that we probably learned at some point throughout our schooling to help with remembering the colors of the rainbow. I know there's some different math ones, but more functionally for day-to-day use, sometimes I'll have clients that will come up with an acronym for the 3 things that they need at the grocery store. If they need bread, milk, and eggs, they might say BME, BME, BME. And I know that doesn't necessarily make sense, but thinking about the first letters and that acronym can help. While we talk about notes and tools and strategies a lot, notes and tools a lot, the important thing also to remember is keeping these notes in one place. And I would keep things consistent. So sometimes it actually kind of works against us when we have too many strategies. Too many notebooks, notes in different notebooks, notes all over the house. So try to have a system and keep notes in one area, whichever way works best for you. Memory journals can be helpful. And that can be tailored, to your needs. It can be, something that you write in a little bit every day, what you did that day, anything that sticks out. And sometimes I actually have patients, this is a little bit on a side, but write in a journal before bed. And sometimes from a memory standpoint, but I know also sometimes even myself, when we have a lot going on, it's hard to kind of wrap our minds around everything that we need to do. So getting thoughts out of our head and into a notebook can actually help us to kind of just know that information is written down and kind of help with sleep and some issues that might come up as far as attention go. I love medication organizers, whether you have, I have 2 vitamins and I still use one. And if I don't take my vitamins. So medication organizers are helpful and not only to help remember to take them, but I know that there are times where we might think, did I take my medication? I don't know. And if you have an organizer, you can just check versus having to count pills. Labeling items can be helpful. Labeling items around the house, which also kind of goes hand in hand with organization, as well as taking pictures of things to help yourself remember. Okay, so that will kind of wrap up the brief summary of the strategies and the tools that we talked about the last session. So I'm going to go ahead and stop sharing the screen.